Despite substantial evidence that investment into social and material equity increases overall population health for a fraction of the cost of investment into acute care and medical treatment, only 5% of the Canadian healthcare budget is allocated towards public health, a fraction of which goes towards social and material equity. Social inequity refers to differences in social support, age, and social status. Material inequity refers to differences in income, education, and housing. The purpose of our study was to investigate the impact that social and material inequity have on local healthcare access, utilization, and outcomes. Our study is funded by the Erie St. Clair LHIN and is currently in the planning stages. Therefore, my presentation will mostly focus on the results of our extensive literature review. We found that overall, materially and socially deprived patients had lower rates of access to specialty care and primary physicians. They had higher rates of utilization of the emergency department and health services overall. In fact, socially and material deprived patients used hospital services 171% more than those who are not deprived. They are also more likely to use the emergency room for non-urgent causes and to be hospitalized for chronic conditions that could be managed in a primary care setting. Negative health outcomes also increase dramatically as one goes down the spectrum of deprivation. Higher rates of obesity, diabetes, cardiovascular disease, mental health problems, and premature mortality were found in those who were the most deprived. In fact, patients who were most deprived stayed in hospital an average of 2.6 days longer than those who were not deprived. To put this in perspective, to stay in hospital for 1 day for one patient costs roughly $1,700. So this is obviously very taxing on our healthcare system. Therefore, healthcare investment should focus more on righting social and material inequities to reduce the difference in access, utilization, and outcomes across social and material classes.